This is Crystal Phend with MedPage Today here in San Diego at the American Diabetes Association meeting, where researchers reported that a biologic drug used to treat arthritis may slow the progression of newly diagnosed type 1 diabetes. Dr. Skyler of the University of Miami Diabetes Research Institute presented the results at a press conference here.
We did show a beneficial effect at the end of 2 years, which was the predefined primary endpoint. There was a 59% higher level of C-peptide in the abatacept group than in the placebo group. And in looking at the actual curves and their decline, it projected out as a 9.6 month delay in the decline of C-peptide, so that there was an initial effect seen for the time, but then beginning around 6 months, the curves began to decline, and it projects out to a 9.6 months delay. We think that and it was totally safe in terms of the side effects. The complete display of that is available to you online in the Lancet paper. We think what it says is that this may be a potential component in a combination therapy approach.
However, the treatment regimen used in the study might not be feasible for clinical use.
In the study, the patients got 27 infusions over a 2-year period intravenously. And I don't think that's practical for wide-scale use. The company is developing a subcutaneous form, and the real questions that we still don't know the answer to is whether if we gave a shorter course of it, since we only had a delay of 9.6 months, we would have seen the same effect as giving the drug out for 2 full years, and also whether or not you need to sustain the administration on a continuing basis to continue to see the effect and the separation of the two groups. We'll learn the answer to the latter by following the subjects out for another year, which we're doing, and seeing if the curves remain separated or if they come together. The shorter course one we won't know the answer to, but I personally don't think that a series of 27 intravenous infusions would be practical, and would only want to use it in combination therapy or in prevention if the subcutaneous form shows beneficial effect.
So abatacept could help delay the disease process in type 1 diabetes, but may not gain clinical acceptance until easier regimens are developed. In San Diego at the ADA meeting, I'm Crystal Phend, MedPage Today.